A new study is raising eyebrows this morning. It found that when it comes to solving sexual dysfunction in women, the answer may be as simple as a sugar pill. Juju has the story.
Samantha in Sex and the City turned to male Viagra to lift her libido.
What would happen if I tried one of these?
This week, the ladies on The View dished about Zestra, a new sexual stimulant on the market.
An essential oil women can use to feel more satisfied.
Medical surveys show that low sex drive affects nearly 40% of women in this country. But the female version of Viagra was shot down this summer by the FDA, and topical products don't work for everyone. Companies are still racing to find the elusive pill, but perhaps the solution may not be found in a bottle after all. In a new study looking at drug treatments for 200 women with sexual dysfunctions, a quarter of the participants were given a placebo. Surprisingly, after 3 months, 35% of those women reported significant improvement in their sex lives. So was it all just in their minds? Researchers say just talking about problems in the bedroom could be the solution.
All women in this study did have a chance to speak with a healthcare professional who listened to their concerns and, most importantly, took them seriously and really listened to what their concerns were.
Empathy and support, the study finds, can be just as effective as potions and pills.
In the quest to find a medical solution or a magic bullet for women's sexual problems, we may have overlooked some of the basics.
And we are joined now by our medical contributor, Dr. Marie Savard, and there you go again. I mean, it's just this common sense.
It is common sense, but as you said, there you go. Women typically, I think, we're so much more complicated than men. Men, it's often a physiology problem. They can take a pill, it improves blood flow, they get better. But for women, it's more situational, and that means stress in our lives, caregiving, time, so many factors, hormones, whether we're taking medications. So it'll never be a sort of one-size-fits-all pill for women.
I apologize for all those beeps. I don't know if our viewers are hearing it, but I think it's been taken care of right now. But then why did the placebo work so well?
Well, we don't know exactly, but as you just heard in the piece, a number of things happened in this study. First of all, the expectation. Women were told to take a pill every time they were planning to have sex. They were encouraged to have sex at least 3 times every month. And in addition, they did have a number of counseling episodes. They met 3 or 4 different counselors on that first visit and were asked to write about each sexual experience. All of those things really helped, I think, raise awareness and gave women more time in the bedroom, which is, I think, what a lot of women need.
You know, when I looked at this last night, I was struck by one kind of gaping hole in the study. We know the placebo worked for a lot of the women, but we don't know if it worked better than the actual drug.
You're right. And we don't even know what the results of the trial were. This was actually a secondary analysis of just the women who took placebo. It was a drug trial using something, many of us have heard, Cialis, you know, a drug very similar to Viagra. We don't have any publication or any information about how well that drug worked, but we do know that smaller studies have shown that they don't work very well. And as we heard this summer, there was a similar brain effect pill that was not even passed by the FDA.
And so we know that, you know, talking about it may help, but that is so difficult for so many women.
It is. Women are embarrassed. They think it all should work right. They're afraid to kind of talk to their doctors about it. Studies have shown that gynecologists tend not to even ask women about it. And if they don't ask, women will not volunteer or tell. And on the other hand, if a woman doesn't speak up, I really believe firmly that women need to speak up about this question if they have concerns, rule out medical problems. There are things that can be treated. And then talk therapy, behavioral therapy, encouragement, taking time. Many people are thinking,
why don't doctors bring it up on their own?
I think doctors are uncomfortable talking about it. I will be honest, I think it's embarrassing even for physicians, and it takes time. It's a very difficult conversation to have. I've been in the situation, I know, but with patients and even with myself. You go into that exam room and women they're undressed. At the end of the table, the doctor's examining them. It's not a very conducive time to talk about sex and things going on in the bedroom.
But it could help a lot. Okay, Marie Savard, thanks very much.